Okay, let's get started. Week 3 for anterior hip replacement exercises. Come onto your back. We're going to start with pelvic tilts. Lay all the way down flat. Take a minute here to just settle in. Reach your arms long by your side. Feel your shoulders really open up, lengthen through the back of the neck. Make sure you're nice and centered on your mat. Start by placing your hands on your pelvis. Fingertips towards the pubic bone, heels of the hands on your hip bones. Initiate your pelvic tilts from that low pubic bone. Curl the tailbone under. You're going to flatten your back. You'll feel the pubic bone lift up. And then reach the pubic bone long, like you're trying to tip it down for your mat. You'll create a little arch under your back where maybe you could slide your hand under your low back. And then reverse. Curl the tailbone under. Feel how the pubic bone lifts up towards the belly button, your back flattens out. And then reach the pubic bone long and take it into a little arch. Now bring your hands back down onto your mat. Reach your arms long and keep going with your pelvic tilts. Try to initiate the movement from the pubic bone versus around the waistline. You want to really lengthen before you arch and lengthen as you tuck. So as you flatten your back, you should feel a length in your back before you lift that pubic bone up. And as you reach into that opposition, you're going to reach the pubic bone long and then tilt it down. We want to really just articulate through the pelvis, not through the rib cage or the upper back. Doing a few more here, maybe 5, 4. Try and go full range. Really check in, make sure you're not compensating. You're trying to get that tip just as much as you flatten. Just 2 more. And curl your tailbone under as much as you can. So you'll really feel your back flatten into the mat. Now curl the tailbone under even more until you feel the hips lift up just a little bit, maybe just enough to slide your hand under your hips, and then curl your tailbone under. Try to land through the rib cage, then the low back, then the pelvis, and release all the way back down. So this is articulation, curling the tailbone under, lifting the hips, keep pulling the pubic bone up towards the belly button. Shift your weight so you feel just that weight shift into the ribs as you lift the hips up just slightly, and then really curl the tailbone under. Can you place the ribs down before the pelvis touches the low back and then the pelvis? Keep going, curling the tailbone under. Roll through each vertebrae. Then lift the hips up slightly just to get a little hand under your hips and curl the tailbone under. Really push into your feet to curl the tailbone under. And when you land that pelvis, reach it long, take a little arch. So go all the way into that little tip forward where the pubic bone reaches down, and then curl the tailbone under and start your way back up. On your next one, start to lift your hips all the way. So we curl the tailbone under, keep curling, curling, curling. The hips come up, the ribs come up. Reach your hips up into a nice long bridge. Stretch those thighs forward. Find length into the top of the hips. Curl the tailbone under. Come down through the ribs. Keep curling the tailbone under, one little bone at a time until your low back lands, then your pelvis, and then release and arch. Find it again, curl, lengthen through the back. I'm going to pull that pelvis up, lift the hips, reach long through the thighs, reach long through the knees, and curl the tailbone under. We're coming down one bone at a time, starting through that upper back. Keep curling under through the lower back, articulating all the way through the pelvis. Maybe you exhale on the way up. And just work on that articulation. Take one little bone at a time. Few more here. Making sure you have that nice alignment. Your knees stay in alignment with your hips. Your heels are in alignment with your sit bones. Trying to come up as high as you can. Articulate one little bone at a time. Come up as high as you can. Really lengthen through the front body. And do one more. And then come all the way down. You're going to straighten those legs nice and long. Start with some quad sets, just tightening up the quads and releasing. For more length, you can point through your feet and tighten up your quads and release. So you're not squeezing your butt, you're finding the quads. That muscle straightens the leg. It's called a quad set. Just squeeze and release. Squeeze and release. Just do it a few more times. 5, 4, trying to get the legs as straight as possible. 3, 2, and 1. And we're going to bend that left knee because we're working on that right leg. Fire up that quad. So that quad is going to stabilize the knee. As you float that right leg up, pull the abdominals in. Come up to the height of the other knee and then lower that leg down with control. Don't lose the quad set until you land. Then you can release your effort. Find the quad set again because that's going to stabilize the knee and keep the leg straight. Now pull the abdominals in. From the hip, we lift to the height of the opposite thigh and keep that quad set all the way down. Release at the end and find it again. Quad set, straighten the leg, lift from the hip, pull the abdominals in, and lower with control. Don't lose that connection until you feel the bottom, and then release. Quad set to stabilize the knee, abdominals to stabilize the pelvis and the spine, and then we lift from the hip. So we want to do all that prep work before we lift the leg so everything's nice and stable. Keep going, really point the foot so you can get as much extension out of that right hip as possible. Release. Maybe you can add your exhale. You have 5 more here. Keep that quad really engaged because as the hip feels a little weak to lift, you're going to really want to rely on that quad to keep that leg straight. 3 more. Release and reconnect each time. It's going to help with blood flow, circulation, and just overall healing. That right quad is a little bit weaker, so we want to really ask that quad to work every single time. We want to find it, recruit it, keep it nice and stable all the way up, all the way down. Last one. Good, and then you're going to roll to your left side. So for the sake of the video, we're going to just be focusing on your right side. Roll to your side. Place a ball or your hand under your head. You can even lay nice and long here. Both legs are going to go really, really straight. Flex that bottom foot. That left foot, that edge of the foot is going to help you balance and give you a little connection into the mat. Your hand can come here in the front. You're going to flex that right foot. So keeping the quad nice and connected to keep the legs straight. Now we're working that hip, that little glute medius there to float that leg up to hip height. You're not going to come too high. Keep the ribs connected so you don't sink into the floor. You want to stay lifted with your abdominals, floating that right leg up, lengthening it as you come back down. And lift and lower. Good. Keep reaching even longer through that heel. So we want to really lengthen that right leg. We don't want to feel that compression as your hip is healing. We want to have nice long length. Feel that rotational component in your hip socket. No compensation in the right low back. So what's happening is the hip wants to hike coming into the low back. So lengthen it out, stack the hips. Really work from behind that hip bone, that little soft pocket there in your glute. Just 3 more. Reach long. And last one. If you need to take a break, take a little break. You can always use your fist and give your hip a little tap. And then moving on to your circles. Now you're going to go with a pointed foot. Reach nice and long and make those circles up and forward like a little salad plate, maybe teacup size. Keeping the ribs together, the abdominals pulled in, your hips are still and stable, so we want to really stabilize so that we can move efficiently through that new hip. Keep reaching long. Just 3, 2, and 1, and reverse. Use your glute to take the leg back. You want to go up to go back. Up to go back. Really feel that glute max starting to fire up to pull the leg back. Good, just 4, 3. Reach a little longer. Maybe you can lift that left rib cage up. Last one. And then roll all the way onto your back. Feet together, knees together. Put your hands on top of your hip bones. Don't have your knees too bent. So nice soft bend in the knee. Keep the pelvis really still. Just going to go from side to side, maybe 2 inches. Lower trunk rotation. So it should feel good. Just like a nice little break. Side to side. And then if you want to go a little further, you can. You can take the knees off to the side, maybe to the lateral hip instead of the hip bones, maybe a little further to that outer hip. But again, we're trying to stay mindful of your alignment and your frame. Shoulders over hips, nice, efficient, precise movement. So you can really influence and encourage that nice healing of your new hip. All right, so we're going to take those feet hip distance. Hands are going to go on the pelvis. You can take your fingertips and come onto the inside of those hip bones. So if you remember to find your transverse abdominis, you can give yourself a little cough. Feel that band of muscle pop into your fingertips. That muscle's job is to compress the spine and the pelvis, meaning that it doesn't move you in any way, it stabilizes you. So think of like a really nice tight little corset, or that your pants are getting cinched nice and tight all the way around. Want to feel kind of that hug of the hips in towards center, stabilizing the abdominals. Keep your fingertips on those hips. Float one leg up, find a little march here, and then float it down nice and soft, land. As you switch to the other side, make sure your hips are not moving. So we want to stabilize using our abdominals around the pelvis and the spine, pulling those muscles in, not allowing any movement or tipping in the pelvis, keeping the spine nice and still, and just start to focus on the hips rotating in the socket. I'm going to have a rotation in the hip socket as I float one leg up. Abdominals are working harder than anything else. Just floating that thigh up and controlling it back down. So if we can really stabilize the pelvis, you're going to have a nice stable spine. Nothing's moving from side to side. As you transfer your weight from one to the next, that's where you're really using those abdominals even more as you transition from one side to the next. Otherwise, if I land one foot and completely release, I'm going to have that tip and I'm going to lose all my connection. So just focus on the stability for now. This might feel easy to lift and lower your legs. It's more about an abdominal stabilization exercise and really trying to work the precision here of how to keep the pelvis still as you transfer your weight from one side to the next. Just do a few more. We're going to add on to this exercise for week 4. So see if you can really focus on the ribs. So here's your abdominal layers. You have a little lift of your pelvic floor. You have your transverse really compressing around the spine. And then think about how the obliques kind of tend to pull those ribs together. There's some abdominal layers there for you to focus on. Just do a few more. And then to end, obviously you can flip over onto the other side and do your other leg, especially when you feel more comfortable laying on your operative hip. For now, for the video, we're just going to do that right side, and then you're going to end with sit to stands. So using a normal chair, you can have your hands crossed, stacking your hands on your sternum. Oops, little mic. And that's going to keep the momentum out of the arms. So making sure your feet are hip distance and in alignment as you hinge forward. Drive through the heels, use your glutes to stand up nice and tall, and then sit back down with control. Make sure your knees are not floating in or out. You're using your hips, your core, your quads, and your glutes to really make this motion happen with control. If you don't want to keep your hands here, you can put them on your hips. Just do a little tap here or a full sit and release, depending on how you feel. And then hinge and stand. You can also reach your arms out. Really slow that descent and stand with control. So lots of options with your arms. Maybe you exhale as you stand. Do about 10 of those. As you progress, these exercises get easier. Add on a second round. Maybe do them a few times a day. We're looking for alignment, precision, no compensation, nice alignment with the feet, the knees, using your glutes to really drive you up. Feel that connection down through the heels. Keep those abdominals connected. Pretty soon you're going to graduate from these sit to stands and advance your exercise. For now, just really work on your precision. A few more here. And go at your own pace. And then when you've had enough, you're all done with your exercises. Again, go through this a few times if they're starting to get easy, and then we'll progress it for next time. All right, I hope that was helpful. Take care.